Welcome to another episode or another informative session of Marshall News and Views on Marshall Cable TV 1. We've had some very interesting programs as we've been going through this, and hopefully they've been very informative to you as we've covered such things as MARSH. You remember that acronym, Marshall Area Regional Sports Hub, which includes the ice arena, all the softball fields and the baseball fields. We've already hosted one state tournament in hockey, and now we've got next month we've got a state baseball tournament that's going to be here. So there's a lot going on just right out here in this intersection in Marshall. We've talked about construction projects and letting you know what you're going to be up against with the streets here in Marshall. We've talked about the parks themselves. We've had a lot of good conversations. We've talked about Memorial Park and what's coming up with that, the fire department and their big plans for that. Now we're embarked upon a new series, and it's a two-part series. This particular series is on healthcare in Marshall. And boy, it's an interesting story because it's a good story. And we've got two entities in Marshall providing healthcare, and we're kind of focusing on how much better healthcare is in Marshall than what it was 6-7 years ago. And trust me, we've come a long, long way, and we really have quality health care now in Marshall. We'll be airing these episodes very, very soon, and we'll run them back to back. How we do that is one day, excuse me, one day one entity will be on, the next day the other entity will be on. Then when we get to the weekend, we can do pretty much whatever we want. So we'll run both of them back to back. So people will always hear about the services that are available to them here in Marshall that they're not going to find in other communities. They're much larger than Marshall. So it's a good positive story, and we're anxious to get on with it. If you just happen to be catching this running through the channels and you've caught us on your cable and you'd like to know more about it, well, there's a couple other ways you can get a hold of us. You can get a hold of us on YouTube. You can find us on Facebook, or you can just go to the MarshallTVStudio1.com website, and you'll see all the episodes. You can click on whichever one you want to watch and get caught and brought up to speed. So with that in mind, let us get back to where we want to be, and that's talking about ACMC, Affiliated Community Medical Center here in Marshall. Now, I can give a little bit of history on this because I consider myself an old-timer. I've been here since 1969. When I came to town in 1969, you weren't in town yet. It was the Doctor's Plaza, where Huffman and Brobst is right now. That's where the doctor's offices were. Just a couple of, half a dozen maybe doctors that were in there and providing us with good medical care. That's not a problem. Then they moved up to the hospital location when an addition was put onto that and did some expansion. And then from there, things just seemed to mushroom. Things got bigger and better, and now you're in a separate facility because you just keep outgrowing things and getting bigger and better. Now you're in your new facility out here by, well, Marshall. Around here, everybody knows where the old Kmart spot is. Kind of like I bought the house next to the old Johnson place. Well, you got the place next to the old Kmart place, you know, and just a tremendous looking building with a lot of services going on there. And we're going to zone in on one of those, and that's the surgery center, which is a same-day surgery center. And we'll get right into that. And Dr. Middling, why don't you give us a brief outline of yourself, and then start talking about whatever you want to talk about.
Well, first of all, I'm not a doctor.
Okay.
I'm a registered nurse.
Okay.
I've been out here in Marshall for about 15 years. I worked as a nurse at the local hospital before moving over to ACMC and transitioning into my role as the manager out there at ACMC Surgery Center. We've been open since about 3 years now. They broke ground in 2013 for the surgery center. Took about a year to go ahead and complete the whole building process. By the time we got through all the construction and getting through all the different surveys and regulations, it took about a year. Finally, in August of 2014, we finally took and were able to actually move into the facility. Went through and completed a couple extra surveys in the following months of October and November before starting to see our first patients starting in January of 2015. Surgery center is about 10,000 square foot, same-day surgery center. It means it's just outpatient only. We do not do any overnight stays there at the surgery center. Roughly, people come in, you're there for about 3 hours from start to finish. We offer a variety or a multitude of different specialties that come, anywhere from endoscopy to ENT, podiatry to general surgery. We have about 14 different physicians who come in and provide these specialties to our patients. And I think it's just a great way for people to come out and get, great care and quality care close to home.
Yeah, and I looked it up on your website, and it says that you got 2 operating suites, 2 endoscopic suites, private pre- and post-operative recovery areas, waiting rooms, consultation areas, and support space. So it really is a destination for somebody to go to when you got to have some health care taken care of. Correct?
Correct.
All right, we're on the same page now. So, and then also it talks about what procedures you can do there. Now, if I'm stepping on something you want to talk about, you just stop me.
Doing good so far.
Okay. Specialties include anesthesiology. You got ENT, the old ear, nose, and throat, as we've always known. The GI and the endoscopy, the gynecology, the general surgery, orthopedic surgery, including the hand, podiatry, urology, and vascular surgery. I think that pretty much covers a pretty broad area until you start getting into the really big stuff like hearts and that. Now maybe we got to get on the truck and drive someplace to get that done. So there's an awful lot of services available to you right here in town at ACMC. So what would you like to visit with us about?
Well, it is about outpatient surgery.
Yes.
And surgery has evolved over the decades. And in the old days, general anesthesia took a toll on patients, and they had to spend a night or 2 or 3 in the hospital just to recover from the anesthesia. The improvements in that have been tremendous. And so many of our procedures now are done under just sedation anesthesia, where the patients can be put to sleep for the procedure, wake up shortly thereafter, feel much more refreshed, little sign of side effects, and go home all the same day. So it's the ideal situation for many of these procedures to be done under local or sedation anesthesia and get back on their way quickly.
I remember when I was in high school, I had my appendix out. I was in the hospital 4 days. Now I think I'd go in by 7, out by noon.
That's correct. And part of that has been some of the advancements in surgery, where we're doing bigger and bigger surgeries through smaller and smaller holes. And the key thing these days is laparoscopic surgery. Now that includes general surgeons, as well as the gynecologist or the OB surgeons who do that as well. And that's where you can go in through a tiny little incision after the patient's asleep, take out that appendix, take out that gallbladder, wake up quickly because of the anesthesia improvements, and then go home all the same day safely.
Safely.
And that's the key thing. It's patient selection as well as the newer techniques that we use.
Okay, fine. Do you have a specialty?
I'm a general surgeon.
General surgeon, okay.
And general surgeons are the ones that do pretty much everything, but many of the specialties do things more, and that leaves us with the main things we do, which are hernias. We are the hernia experts, and also gallbladders, but we do other things as well, and including the endoscopy. The endoscopy can be done by a gastroenterologist, or in this country, mostly in the rural areas, it's primarily done by general surgeons, because we have the knowledge and the skills and the training to do that, along with, in this town, the gastroenterologist, Dr. Joe Willett, who's able to do that for us as well. Those GI procedures are ideal for a surgery center setting, where they come in, get the procedure done, and go home the same day, as long as you plan the right type of procedure. Most GI procedures is in, do a look around, take some biopsies, some minor procedures, and then go home same day. And because we do it all through the scope, minimal chance of complications.
I think I can never pronounce the word surgery with a scope.
Laparoscopy just means we're going into the abdomen.
Yeah.
We used to call them laparotomies. Anytime you got cut open, you had a laparotomy, and now it's laparoscopy because we're doing it with the scope.
Oh, okay.
So endoscopy is going down the channel with the endoscope, Laryngoscopy is where the ENT doctors go down and look at the voice box through a scope. So the scope just kind of describes an additional technique to look at those areas.
I had that done out at your clinic. Can't remember the doctor's name that came and did it. I don't think I could pronounce his name either, but that was a very comfortable, pleasant experience. I suppose I was maybe in his office 10 minutes, 15 minutes, and he scoped it and told me what was wrong, and we set up a plan and got everything taken care of.
But understand the key to all those things is the team approach that we use here. So obviously we want the surgeon with the skills. And yes, Dr. Mellema has excellent experience and excellent skills. He's really top grade in his area. I've been doing it for 30 years, and so lots of experience behind that, and that's key as well. But more importantly is the team effect that we have, and that comes in with the nurses, the RNs that we have, and we have RNs in every level of care there to bring the patients into the surgery center, to check them in, to go through their history in detail to make sure we're doing the right thing at the right time at the right patient so that we don't have complications. And then the next one is the anesthesia, and our chief anesthesia is Jason, who is expert at what he does as well, and is able to gently guide with patients feeling very comfortable because they feel like they're in good hands when they're in Jason's hands, to be gently put off to sleep, and they wake up and they're comfortable and they feel good and want a little breakfast and go home. And that's the goal that we want to accomplish. But every step of the way is the personnel within there, the cleaning ladies that make sure everything's cleaned up before and after the cases, the RNs that do all, the receptionist that brings the patients in. And everything is important that we do the right thing, we know we're working on the right patient and not make any mistakes along the way, and that's where the surgery center excels.
Yeah, yeah. And do you get involved in the, pretty much in the aftercare of the procedure? When you got the patient out of the surgery room and in a recovery room, what all do you get involved with in that?
Well, I'm kind of a jack of all trades, kind of do a little bit of everything while we're there. Pretty much all my nurses, they're experienced in all areas. They've been or trained in every area, so they're not just, nurses don't admit, they do recovery, they even float and circulate over the OR. Nice thing with my nurses, they got a lot of experience combined through the 6 of us that we have. We have over 100 years experience working in just OR alone. So very knowledgeable nurses who take very good care of their patients from start to finish. Myself is working, I do get to every once in a while, I don't just, besides doing all the day-to-day operations, I do every once in a while get to go back in the OR and float back there and help out and assist with procedures. Which is kind of nice, so kind of keep those skills that you
Well, you've been busy building a clinic is what you've been busy doing.
So, right. So it is nice to kind of get back and do some of those skills that you had learned or have learned in the past. I also help out. We have to help out in float and recovery. That's where you go after your procedure, where you wake up, make sure that you're very comfortable, not having any discomfort. After you go from the recovery room, we take you back out to the post-op area where you started. The nurses will come out, talk with you. They get you a little something to eat, get you something to drink, and make sure you're comfortable. They'll go over instructions with you, and we'll get you escorted out the door with your driver.
Okay, good. When we went through that list of specialties and surgeries that are available here, looking back 6, 7 years ago, how many of those probably weren't available?
Well, back in the day, the general surgeons did most of these things themselves. I, as a general surgeon, took out tonsils and took out uteruses and took out appendixes and did varicose veins and arterial surgery. I used to do all of those.
Oh my gosh.
But it's hard to stay up to date on the various specialty equipment used on these and the new techniques that come out, and to stay proficient in each one of those, and that's where the specialists come into play. The advantage is the specialists are willing to come into a surgery center because of the efficiency. They come in, get the patients well taken care of, and are able to go home the same day, both the patient and the specialist.
And the specialist.
So while I live here in Marshall and I'm here for my patients overnight and afterwards, the specialists are able to go home. And if there's a problem with the specialty patient, then they call me as well, because again, I've dealt with all those areas as a trained surgeon. But again, the key thing is that each one of these is specially trained in urology. So they can do the urologic procedures, the simple procedures, some of the more complex procedures when it's done with the scope. The vascular surgery, obviously we don't do big bypasses, but the vein work can all be done on an outpatient basis. It's safe for them, it's simple, and the results are excellent. So it's amazing how we can bring these specialists in for a day or 2 or 3 or 4 a month. And when we're busy, ENT is down here how many days a month? Up to 6 days?
5, 6 days a month.
All right. Very good, very good. As the need arises, you can expand that service, I'm sure.
Come the holidays, when the kids are out of school, the ENT doctor is very busy, and,
Yeah.
and again, the patients are willing to wait, and the GI doctor or the ear, nose, and throat specialist is willing to accommodate that and come down extra times just for that.
You know, so it's kind of evolved into a win-win situation for everybody. You know, the doctors specialize, so they're much better at what they're doing. They're not like you when you started out, where you did absolutely everything, and there might have been times that you're in a surgery room wondering, let's see now, what am I supposed to be doing here? I'm sure not, but that's you know, that's eliminated. You as a general surgeon have the knowledge to know that this one could be a little touchy. Maybe we better have one of the specialists come in and handle this one, and the patient gets the best possible care ever, and they get home right now.
And they get it done close to home.
Close to home, that's the big thing. You know,
Exactly.
You don't have to travel 100 miles one way, so you spend 2 hours on the road getting there and 2 hours on the road getting back. The family can be there waiting for you when you come out to visit with you, take you home, spend some time with you. They don't have to watch you half sleeping or whatever in the car on the way home. So,
And they can do their follow-up care right here as well, because when the specialists are here 4 to 6 times a month, then all the follow-up care can be done right here in town. They don't have to go off to another clinic to be seen for their stitches out or anything of that nature.
yeah. When the specialists come in there, do they bring a nurse with them, or are the nurses here trained to just take care of, you know, the needs of that particular surgeon or doctor, especially on the follow-up stuff?
I would say, other than urology, where they have some really specialized equipment, and Andy can correct me if need be, that the technicians provided by the Marshall Surgery Center are all we need to be our assistants. They're all trained in broad areas, and they can help us out on every step of the way, and they know how to troubleshoot the equipment. I mean, this is mechanical, electrical stuff, and sometimes lights go off, and they know how it works, and they know how to fix it.
And we do have a couple of specialists who do have their nurses come through, and they do assist with them over at the surgery center. I think it just adds to the continuity of care. So they're there when patients come back for their post-op eval. If they've got questions, the nurses, they were in the room, they can answer some of those questions, and just let some of those questions those patients have. So.
Okay, it looks like you got pretty well all the bases covered. You can go in and have your surgery done right here in town, stay home, the family can wait for you and go back to your house with you. But good qualified personnel is the big thing, and that's what we got. So it's really a good situation we got. So healthcare is much better than what it was 5, 6 years ago, and probably get better yet as you go along. When you look at, all right, here's a question I want to ask you. You built a very impressive clinic out there, and you've got your 10,000 square foot surgery center in addition to that. How long before you think you'll have to add on? Are you finding yourself cramped in some places already?
Not space-wise.
Yeah, every once in a while you hear there might be, if there some specialists come, there might be a little bit with some trying to find exam rooms from time to time, but you know, otherwise I think it's pretty accommodating. And
yeah, the OR suites themselves, we've still got one on standby that's only being used as the pain clinic right now, and it really is a matter of adequate personnel to staff the rooms, and obviously you can't have 7 surgeons all at the same
That's
time
right.
Monday morning, so everyone's got to be willing to be a little bit accommodating. My advantage, you know, being here all week long, is that I can fill in the empty spots when need be. But but again, Andy's done a great job of coordinating, getting the schedule nice and smooth, and so Surgery Center tends to be busy 5 full days a week.
Well, that's good to hear. I think that's good to hear. I'm pretty sure it is. But you know, you bring up a point, and this is, I've been thinking about this for a couple of weeks now, and I think maybe this is going to be another show in itself. We hear a lot on the radio, we see a lot in the local newspaper, jobs leaving Marshall, good paying job, executive type salaries leaving Marshall. We never hear anything about replacement of those positions. And when you look at healthcare in Marshall the last 5-6 years, what ACMC has done, what Avera has done, there's an awful lot of economic development that's been done there between those two entities. So yeah, in one accent we got one going off, but boy, we got a ton of money coming back in, and that's really important to Marshall. You know, I've often said that Marshall's a community of 14,000 that has the services and the problems of a community of 50,000 people. And when you stand out on College Drive from 11:30 to 1:30 and look at the traffic, I think you can justify that statement. Just an awful lot of people coming, and a lot of people going to the two medical centers here in Marshall. So, anything else you'd like to bring up?
Well, you know, the question is, you know, how do you maintain the skills and the quality? And we have several programs where that we are certified, and Andy's going to talk about that. We have an initiative on GI quality where we've reached a high level of recommendation, and Andy's going to talk about that as well.
So we're part of this GI, which is quality reporting for endoscopies. And what it does, what we can do with this is it allows us to benchmark or compare ourselves amongst ourselves internally, but it also goes ahead and allows us to externally benchmark against other providers that are participating in this GI Quick program. There's a lot of different measures that go into it that physicians, of course, have to meet when they're doing these procedures in order to, you know, even go ahead and be part of this whole entire program. So just to shows the public that we are going above and beyond to show and give the best quality care that we can to our patients. We're also looking forward and getting accredited anytime between now and September.
Surprise!
Which is a survey they're going to come out and just make sure to come through, check us out, and make sure that we are doing what we're supposed to, and to show that way we can use them once we've completed the survey and put that and advertise, showing the public that we are doing everything
and that's
above
an
and beyond.
accreditation you have to do every so often, or?
It'd be accreditation that we do about every 3 years.
Okay. Okay.
So
When we talk about 2 surgery rooms and that, I would have to think it's difficult to keep 2 surgery rooms busy all the time, but then you've also got the staffing of those surgery rooms. You got surgeons, but do you have staff? And I would imagine Minnesota Department of Health or American Medical Association or whoever, they got their ideas of how many people you should have in that room. You should have 10 people in a room that only holds 6. Correct?
Well, there are certain requirements. Mainly what the room they're made up of for a procedure would be, you have your doctor, you have your anesthetist, you have a circulating nurse who is responsible to kind of prepare everything for the procedure prior to bringing the patient back in. And for most persons, you have 1 to 2 scrub techs who are assisting the surgeon during the procedure. So on most days, you have probably takes about 3-4 staff per room, depending on what the case is. Some of the smaller cases, you're able to get by with a few less staff, but that's just the OR. You also need staff to go ahead and staff the recovery room, which there's guidelines that say usually a minimum of at least 2 nurses present in that at all times when patients are present. And then we also have nurses out front who have to go, who are doing the admitting and discharge of patients too. And in some instances, those situations might be the same person doing, depending on the caseload. Maybe the same nurse who admits is also doing some of the discharging that day as well.
Yeah, okay. So there's a lot that goes into the process.
Right.
And so much of it is paperwork and documentation. In the old days, the post-op note was patient did okay. And now it's a lengthy note plus a dictated note on top of it, and they have to be done right away. The nurses are documenting continuously during each case as to what's going on during the case. The anesthesia is doing the same thing. So you got electronics, you got a computer in this corner, while the surgeon's just trying to do the surgery. But it's all required. That's how you show that you're achieving the level of quality that you want to achieve.
Okay. Well, gentlemen, thank you very much for coming in today. I want to remind our viewers that you can catch us on your cable access channel. You can get us on Facebook. You can get us on our website. In fact, I think you can even get us on the City Marshal's website if you want to go there. Then you can get selective of just exactly what all you want to watch on that particular one. And on the Facebook one, if you want to submit a comment, you can even certainly submit a comment. I'm not saying we're going to comment on those comments, but it's good for us to hear what's going on in the community and what people want to hear and what people want to see. So with that in mind, I think we'll wind this down and we'll get this ready to put on air. And I think with today is Tuesday, I think by Thursday we'll start airing these episodes and people will find out just exactly how good health care is in Marshall.
Can I just add?
Yeah.
And if you want to find out more information, the best thing is just you can go to our website at www.acmc.com. You can click on locations. It brings up every location that ACMC has a clinic at. You can click on the specific area, click on the Marshall Surgery Center, and it'll go ahead and list more procedures that we are able to do. And you can even go ahead and click on a link, and it shows Dr. Kidd, for instance, and it'll show even all the procedures he can do or perform for patients, not just necessarily here in Marshall, but
I did that before the show today. That's where I got this information. And excuse me.
Might need to see a doctor.
Yeah. Well, can we lay on this table? But yeah, a very user-friendly website too, I might say. You can go right through it. So with that in mind, that's it for this session of Marshall News and Views. Thanks for joining us.